So hello, my name is Sal. I'm going to be the provider that's performing your physical exam today. I will be taking a look at your gastrointestinal system, and I'll be doing an assessment on your musculoskeletal system and on your neurovascular system. Do you give consent to record this video?
Yes.
Okay, thank you. So this is Mook. Mooker is my patient for today. She's awake, she's alert, she's ambulatory. I watched her walk into the office, and her skin color looks pretty normal for her ethnicity. We're going to start with the exam on your abdomen. My patient today doesn't feel comfortable being completely exposed, so we will begin the exam to keep her as moderately covered as possible, still while completing the exam. Do you mind laying down, please? Okay, so I'm going to start with, do you mind pulling up your shirt? Okay, thank you, and I will pull your shirt back down. I'm going to start with the exam of the abdomen. I'm starting first with just inspection. So what am I looking for? I'm looking for any peristalsis. I'm looking for any scars, any distension, any abnormalities with the abdomen. The only abnormalities noted so far, and I would note the tattoos on the left lower quadrant, and I will note that there is an old scar that's healed here. So my inspection is complete. At any point throughout any of the exams, Mooker, if you do have any pain or discomfort, please let me know. So after my inspection, I'm going to start with, my inspection is complete, so I'm going to start with auscultation. So I'm going to start listening at the right lower quadrant, and I would listen for at least 5 minutes, but for the sake of the video, I will move forward as soon as I hear vowel sounds. So now I'm listening to the right upper, the left upper, the right lower. And those are normal active vowel sounds. What I'm going to do right now, I'm going to also listen to the vascular sounds in the abdomen. So I'm going to start with the aorta. Then I'm going to move down to the renal. Then I'm moving down to the iliac. And no bruit noted. Now I'm going to percuss the abdomen. So I'm going to start with the right lower quadrant. And it's all tympani, which is normal. Now I'm going to measure the liver. So I'm going to percuss all the way up, right about there, to change the sound. And okay, then I would measure, and that was about six centimeters. Now, what I'm going to do, I'm going to ask you to take a really deep breath. Okay. Oh, well, no, percussion. Relax for a minute, I'm sorry. So now I'm going to palpate. So I'm going to start with light palpation, right? Any pain?
No.
Okay. And then I'm going to, before I do that, I'm sorry, I am going to percuss for the liver, and sometimes dullness can be heard over the liver. Take a deep breath. Okay. Any pain?
No.
Okay. And I'm going to do the same thing for the spleen, okay, which tympani's heard, which is normal, because if you should hear any dullness, that would be concerning. I'm going to continue with light palpation. Any pain?
No.
Now I'm going to go into deep palpation with both hands. Any pain?
No.
Okay. Good. Okay. And this is where we would take a deep breath. Okay. And any pain?
No.
Okay. I'm going to palpate for the kidneys. Any pain?
No.
On this side as well. And now I'm going to look at the aorta, and that's measure the aorta, and that's normal. So I'm actually done with my abdominal exam. I'm going to move over to the chair where we can continue with our musculoskeletal exam. Okay, so for our musculoskeletal exam, I'm going to start with a general inspection of my patient. I'm starting with the upper extremity, so I'm going to look at the neck, I'm going to look at the shoulders, I'm looking to see if there's any asymmetry within the shoulders. Can you move forward a little bit with the chair? Thank you. Looking for any kind of asymmetry. If you should have any pain or tenderness, please let me know. Okay, so I'm going to start by palpating along the sides, down the AC, down the scapula, okay, into the shoulder blades, within the joints. Any pain, any tenderness?
No.
Okay, that's great. So I'm going to palpation. We're going to do range of motion of the head and neck. So I'm going to ask you if you can place your chin to your chest. Okay. If you can move your head backwards, be careful. Look at the ceiling. So we have flexion first, extension. Any pain there?
No.
I'm going to ask you to use your left ear and touch your shoulder. Your left ear and touch your shoulder. Okay. Your right ear and touch your shoulder. I'm going to ask you to look over your left shoulder. I'm going to ask you to look over your right shoulder. That's great. Range of motion is intact. Now I'm going to ask you to extend your arm all the way up. Okay. So now we're looking at the range of motion for the shoulder. I'm going to ask you to place it on your back. Okay. I'm going to ask you to bring it low. Okay. I'm going to ask you to cross your arms in front of you. Great. I am going to finish the range of motion of the neck. If you can press against my arm. Okay. Press against my arm. So the strength is 5 out of 5. I'm going to ask you to push down. Great. I'm going to ask you to, now I'm going to move to the elbow, move your arms to your body. Great. Now straighten out. Okay. So now we're going to pronate, keep them face up, supinate. Okay. Awesome. Bend your elbows back. Prevent me from pulling you. Prevent me from pushing you. That's awesome. Now I'm going to take a look at your hands. Okay, I'm just going to examine your fingers. Any pain?
No.
Okay, so no pain, no tenderness, no deformities. Note, can you move your fingers around? I am going to palpate the snuff box as well. Okay. All right. Can you flex, extend? Okay. Any pain while doing that?
No.
Radial, ulnar, deviation. Awesome. Now I'm going to check for, I'm going to do my pulses. So I'm going to do my brachial 2+, and I'm going to do radial 2+. Now I'm going to do my reflexes. So I'm going to start with doing brachial, Awesome. Bilaterally. Oh. Okay, there we go. And now we're going to do brachioradialis. Here we go. Awesome. Both sides. Okay, and those are normal findings. Now I'm going to do the, I'm sorry, I said brachial. That was biceps. Sorry, biceps, brachioradialis, biceps, brachioradialis, and now we're going to do the triceps. So we're going to support the arm. We're going to find process. Okay, awesome. And that too was a 2+. Okay, so we did our range of motion. So now we are going to move down to our, we're going to move to our, we did pulses. Now we're going to move and complete our neuro assessment. So if you can just close your eyes for me. Okay. I'm going to start with, can you tell me what you're smelling?
Citrus.
Citrus, that's great. Cranial nerve number 1. Now I'm going to ask you to cover one eye, if you can use that to cover one eye, and just tell me what finger?
1, 2,
Okay, cover the other eye.
2, 3.
Okay, now I'm going to check your pupils. I would at least turn this light off, look straight ahead. Awesome. Follow my finger. Conversion. So pupils equal, they react to light positive perla. So that was cranial nerve number 2. I'm going to test cranial nerve number 3, 4, and 6. So I'm going to ask you to close your eyes for me. Great. And then I'm going to ask you to, you can open your eyes. Okay. You can follow my pen, right? Just move your eyes and not your head. Okay. That's great. So we tested cranial nerves number 3, 4, and 6, and they are intact, extraocular movement. So now we're going to go to cranial nerve number 5, and we are going to test the facial nerve. So we'll do cranial nerve number 5 and number 7 together. So I'm going to ask you to close your eyes and tell me if what you're feeling is sharp or dull.
It's dull. Dull.
That's great. Now close your eyes tight. That's great. Now open them. Okay, I'm going to ask you to clench your jaws really tight. So I'm palpating the temporal and the masseter muscle. So now we're going to move to cranial nerve number 8, and I'm going to test your hearing. If you can just cover one side of your ear for me, great. And tell me.
1, 2, 3, 4.
Cover the other.
3, 4, 5, 6.
Okay, that's awesome. Now we are moving to cranial nerve number 9 and 10. So I'm going to ask you to open your mouth and say ah. So I'm looking at the rise of the, put it down a little bit. Stick your tongue out. The uvula is rise of the uvula and swallow. Great. So now we are looking, now we're moving to cranial nerve number 11. So I'm going to ask you to push against my hand, and then shoulders. Push your shoulders up. Awesome. Now I'm going to move to cranial nerve number 12. So what I'm going to ask you to do for cranial nerve number 12, I'm going to ask you to stick your tongue out, all the way out, move it left to right. Okay, awesome. Now you can put it back in, push it against my finger. Great. Push it against my finger. So now we've completed our cranial nerve exam. I'm going to move to the lower extremity. I'm going to put this away. So I'm going to start by just an inspection, general inspection. Looking, my patient would be undressed in a gown, looking at the symmetry of the legs, both standing and sitting, making sure that there's no obvious deformity, the skin is intact, the skin color is normal for their ethnicity. I'm going to start by palpating down the femur, all the way down to the legs. I'm going to palpate over the kneecap, making sure that it's intact, it's nice and firm. Okay, we're moving all the way down to the tibia, a little laterally to the fibula, and I'm going to palpate even the posterior aspect. I'm going to move down to the feet. I'm going to palpate, looking for any tenderness, any deformity, the medial, lateral, malleosis, in the back. While I'm here, I'm going to check for pulses bilaterally. Okay, so we have our pedal pulses. We're checking all our pulses and the posterior popliteal, which they are 2+. So all the pulses are intact. I'm going to ask you to extend. Okay, now flex your leg, extend, flex. Any pain when you do that? I'm going to ask you to pull your knees up to your chest. Awesome. Up to your chest. That's awesome. I'm going to now ask you to prevent me from pushing your knee in. Okay, your foot back. Okay, prevent me. Okay, so strength is 5 out of 5 as well. I'm going to now ask you to, I'm going to check the reflexes, your patella reflex. So I'm going to actually help. Okay. I'm going to check your Achilles. I'm going to support your foot. Okay. Okay. So with the, and reflexes are 2+. I'm going to ask you for the foot. I'm going to range of motion, no laxity noted in the ankle. Range of motion as well, no laxity noted in the ankles. I'm going to ask you to wiggle your toes. Okay, I'm going to ask you to push your foot down, flex, up, plantar flex. I'm going to check your plantar reflexes. So I'm going to, in the J, move it up and around, and that's normal. Okay, and that's normal as well. So we did test the reflexes on the Achilles. I'm not sure if I did this one. Okay, that's normal, and that's normal findings. So I'm going to ask you to reflex and extend it. Okay, push down. Okay, now I'm going to push your foot down, prevent me, in the other direction, prevent me. Strength is 5 out of 5 in the lower extremity as well. So I'm going to test. I'm going to ask you to stand. Okay, making sure that we are still facing the camera. So turn this direction. I'm going to look at her back and her hips. So I'm making sure that the spinal column is here in, the vertebral column is in alignment. There's no kyphosis, there's no lordosis, there's no abnormal curvature of the spine. I'm looking at the arms bilaterally. They are equal, shoulders are equal. I'm going to ask you to bend forward, flex, touch your toes. Okay, while you're there, I'm just gonna palpate up your back. There's no deformity, there's no step off. This is something that we would look for with acute injuries. You may come back up. That's awesome. Any pain? Okay, I'm going to ask you to rotate your head, your body, actually. Okay, and then rotate to the other side. That's awesome. I'm also going to ask you to just lay back down for a few minutes. I'm going to take a look at your hips. I'm going to palpate your hips. So at first I'm looking for symmetry of the hips. They do look symmetrical. I'm going to ask you if you can roll over on your left side. Okay, so I'm taking a look at the hips. I'm also palpating inferiorly, and I'm palpating over, checking over the iliac crest, coming around in the back. Could you bend your knees all the way up for me? One at a time. The other. Okay. There's no clicking that's noted, and she did that smoothly and without pain. So I'm going to ask you to stand back up. Okay. And I'm just going to ask you to let's face the camera. Great. I'm going to ask you to extend your hip. Awesome. Watch it. Extend the other hip. Awesome. Any pain there? I'm going to ask you to forward and then backwards. Okay. Forward and then backwards. Okay. And so that there's no pain, no deformity, no clicking. That's noted. I'm going to ask you to have a seat. Okay. And we're going to continue our sensory assessment. Okay. So the series of tests that I'm performing, sorry, I'm back in camera. The series of tests that I will be performing involves you closing your eyes. Okay. So if you can close your eyes for me, thank you. And if you can let me know if where I'm touching you, so the dormitone's going all the way up, if where I'm touching you, if it's sharp or dull.
It's dull.
Okay.
Sharp. 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 Dull. Sharp. Dull.
Say it louder.
Sharp. 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 Dull.
Okay. So sensation is intact. Now what I'm going to do next is to keep your eyes closed, and you let me know if you're feeling cold or room temperature. Okay? Oh, I wouldn't do this under circumstances with clothes on.
Cold.
Okay.
Room temperature. Cold. Cold. Room temperature.
Okay. So that is intact. Okay. Now what I'm going to ask you to do is continue to close your eyes. Okay. And let me know what this object is that I've just placed in your hands.
A pen.
Okay. Thank you. That is a normal finding. I'm going to now ask you to keep your eyes closed, and I'm going to hold your hands and let me know if I'm if I'm touching your finger, if I'm moving it up or down.
Down. Up. Down. Up. Down. Down. Up. Up. Up.
And so those are normal findings. I'm going to ask you as well if you can you feel this?
Yes.
Okay, can you feel it now?
No.
Okay. Can you feel this?
Yes.
Can you feel it now?
No.
Okay, so that's a normal finding as well. So what I'm going to ask you to do as well is if you can, so we did that, okay. Oh, sensitive. Okay, so you found, I'm going to ask you if tummy, the number that I wrote in your palm.
7
Okay. And again, over here.
and 8.
Okay. So that's normal. I'm going to also ask you to 2-point distinction. Okay. Let me know. Where's my other palm? Okay. I'm sorry. Let me know when you are feeling 2 points, and then let me know when you can no longer feel them.
2. 2. 2. 1.
Okay.
2. 2. 2. 1.
So let me know where I'm touching you, okay? And say the location.
My hands, wrists,
Okay? One, both, or one?
both.
Okay, what about now?
1 wrist,
Okay, which wrist?
my right wrist.
Okay, so that neurological assessment was intact. What I did forget, which I want to add, is that if you can just open your eyes for me, and I would like for you to run your, take your shin, your right foot, and run it down your left shin, starting at the knee, all the way down. Thank you. And the opposite, all the way down. And that was smooth and symmetrical. So our sensations, they were intact. So now let's test our cerebellar function. So what I'm going to ask you to do at this time is to stand for me. Okay. And if you can stand right here. Okay. Awesome. I'm going to ask you to walk on your heels, your toes, tippy toes, turn around, come forward, okay, your heels and toes, okay. Now you can turn back around and face the camera. Now I'm going to ask you to keep both hands at your side, keep your eyes open. Now you can close your eyes, okay. Now, great. With your eyes closed, put your hands forward with your palm facing upward. Okay. Keep your eyes closed. And what I'm looking for here is a drift and no drift noted. And that ends my assessment for today. Thank you.